FERPLEX is a solution of oral iron composed of iron protein succinylate. It exists as a convenient vial suitable for any patient profile, and it contains 40 mg of ferric iron. The iron is encapsulated in a succinylated protein complex, which has the mission to facilitate the iron absorption and to allow powerful and soft treatment against iron deficiency and iron deficiency anemia. When iron protein succinylate arrives in the stomach, the capsule remains entire. As a matter of fact, the complex is not soluble in gastric pH and the iron is not liberated. Thus, the sensitive gastric mucosa stays safe. When iron protein succinylate reaches the intestine, the environmental pH is higher. The duodenal pH allows a protein complex-based capsule's dissolution and its digestion by digestive enzymes. The iron is then liberated in a stable shape, the ferric iron. The intestinal mucosa is also safe, and the ferric iron is now ready to be absorbed by the intestinal villi. This novel and original mechanism of action is the cornerstone of the powerful efficacy and tolerance of FERPLEX. FERPLEX has the specificity to be absorbed in the duodenum while respecting the duodenal mucosa. There are two possible ways for its absorption. The first one is specific to ferric iron, called mucin beta integrin system. The ferric iron is caught by its transporter and brought entirely to the plasma through the enterocyte. The second one is the DMT1, or divalent metal transporter 1 system, which allows an absorption through the enterocytes thanks to a reduction-oxidation reaction. Once the ferric iron has reached the plasma, it is bound to its specific transporter or transferrin. The ferric iron is used notably in the marrow for the erythropoiesis and also in the mitochondrial energetic mechanism essential for life. The ferric iron is also stocked in a ferritin mainly, in the liver and the myoglobin, in the muscle. Compared to other commonly used oral irons, FERPLEX has a maximum efficacy. A better replenishment of the iron stock and a faster increase of the hemoglobin rate is shown after a 60 days treatment with FERPLEX. In clinical terms, this results in significant symptoms reduction in comparison to a usual irons used. Based on the score evolution of each major symptom, an improvement of around 90% is observed in all patients treated with FERPLEX. Moreover, FERPLEX is significantly better tolerated than other usual oral irons, and it is shown by a decrease of more than 54% on total adverse events. These two pictures of the mucosa relevantly show the benefits of FERPLEX versus a usual iron and how there is less alteration with FERPLEX. With 20 years of experience, FERPLEX is the #1 oral iron in Spain, its country of origin. In a study over 1,000 patients, prescribers declared, in 74% we had a very good efficacy. We had over 90% of very good tolerability and over 90% of no side effects cases. In practice, FERPLEX is a convenient and easy-to-use product. Its pleasant taste and its optimal tolerance makes it suitable for children and pregnant women. Since it contains neither lactose nor gluten nor sucrose and colorant, there is no restriction of use for diabetics and hypertensive patients. Thanks to its convenient vials and its low food influence, FERPLEX can be drunk anywhere at any time. FERPLEX, an iron fist in a velvet glove. FERPLEX is the oral iron that your iron deficiency and iron deficiency anemia patients are waiting for. FERPLEX, a maximum efficacy and optimal tolerance demonstrated clinically.